attached to it, and I want to talk about improving your shoulder mobility. Specifically, after people have had a surgery and their arm's been in a sling, a lot of times it's been in this position at your arm, and this is called an internally rotated position with the shoulder. And what that'll do is that'll stiffen it up over time, and it'll prevent you from getting full external rotation, that is, bring your arm out away from you. And then especially difficult when you come up here at this upper motion above the shoulder height. And if you're an athlete, if you play baseball, if you golf, that's going to limit your ability to throw and to swing the golf club effectively, because you're not going to be able to properly load the shoulder. And what that looks like is, if I'm going to go for a baseball throw, I'm here and I'm supposed to be going into external rotation with the shoulder so I can create that whip-like effect. So as I throw, I have enough load and a full range of motion in order to put as much momentum and power into that ball as I can. Now, similar with golf, we have the backswing. This is my right shoulder. My right shoulder is the stiff one. I'm going to be limited when I come up here into my backswing because I'm not able to externally rotate the shoulder here. Likewise, as I go through the follow-through, I need a lot of external rotation in order to recover and bring the arm all the way back, so that way I can get a nice, clean follow-through and swing through the ball all the way. So the question is that how do I know if I have limited shoulder external rotation? Well, the great thing is all you need is a wall. So you're going to come up against the wall, put your back and feet up against the wall. You'll make sure your shoulders stay against it. Bring your arms up and bring your hands all the way back against the wall. If you can go all the way to here, that means you got 90 degrees of external rotation, which is considered normal. Now, if you're a baseball player, you might have a little extra, and you probably should have a little extra, so that way you can impart as much momentum and force onto the ball when you load your shoulder to create that whip-like effect in the shoulder for when you throw. So, you've come up to the wall now, and you see, oh man, I don't have that full motion. So what you can do is you can grab a broom stick from the closet, and you're just going to take your arm, go to the point to where you can't move it back anymore, and you're going to use your other hand to provide a little bit of a force to push it back all the way. And that right there is going to help you get that motion. A lot of people will do this and they'll accidentally start rotating. Be careful with that. You want to make sure you keep your back flat against the wall, and you're pushing it all the way back using that bicep of the other arm to get that motion all the way there. Then, after you've gotten that, you want to get a small weight. A lot of you can probably use like a can of soup at home, or even just a 1 pound dumbbell. And then what you're going to do, you're going to start bringing the weight all the way back to the wall here, strengthening those muscles of the rotator cuff to get to that end range motion. Then what we do is we go to a TheraBand. And with the TheraBand, what we can do is we can isolate it out and strengthen right there at the very end, nice and slow and controlled, so that way we're bringing all the way back. And this will get you all the way to the end range and control that because of the angle of the pull of the band. Then, after we've done that, we move on to more functional rehabilitation and performance training, where we start to load the shoulder and throw. We start to go through more full arcs of motion with cables and bands. We want to make sure that as we're loading this all the way, we're able to get all the way into a more functional position, because very rarely are we just going to hold right here. Usually we're doing longer, bigger reaches, and we want to make sure we stabilize that. If you guys have any questions, be sure to comment below. I love answering your questions. And if you want to watch more videos like this, hit that subscribe button.